Hi everyone, my name is Javier Reto. I'm with SportsMED and one of the 4 spine surgeons here. Today I want to talk about cervical or neck pain. Probably the second most common pain that we have or we see in our clinics behind low back pain. And neck pain itself can be due to many reasons, but certainly we understand that arthritis can play a role or wear and tear on the discs. And so what we'll see and what we'll notice in the clinic usually is a combination of symptoms where folks have the neck pain in the back of the neck, sometimes radiating up, creating some headaches. And oftentimes you'll see that patients will complain of numbing pains down the arms. And the most common places that we see this are towards the bottom of the neck. The neck has 7 vertebrae and 8 discs. The main issue that we see is that the bottom areas of the neck, C5-6 and C6-7, those are the disc spaces. We will see that the nerves coming from there will create pains all the way down the arms, and typically you'll see numbness or notice numbness or tingling in the fingers, and then ultimately this issue that just if it doesn't improve on its own, then you're going to really want to contact us and make sure that we evaluate it. Typically, what we'll do as part of a workup is, of course, we'll take some x-rays to make sure we understand the alignment of your neck. And then the next step is an examination. So when we examine you, we want to make sure that we understand where is this pain coming from and can we isolate it to a certain level. And when we can do that, we are more successful at treating this. So ultimately, we'll say neck pains that come in about for 2 weeks, 6 weeks, anything in that range is something that we always want to consider some physical therapy for. Strengthening the muscles can really provide a significant improvement because it does help to take the stress away from the spine. So that and some anti-inflammatory medications to help take that inflammation away usually does a trick in really over 90% of patients who walk in the door for this reason. Now, we will have on occasion some folks that don't respond to that. And when that happens, we always want to consider an MRI scan to really look at the discs and the nerves and make sure that we know where the issue is coming from. And then finally, there's options to consider once the therapy and medicines have been tried. And if they're not successful, then we'll talk about potentially some injections. And so that's really the typical process that we follow for the treatment of this. And in fact, the majority of patients get better. Now, there is a small subset of patients that really don't respond. And then that's when we end up talking about surgical options. And so beyond the therapy, beyond the injections, if all of that stuff and medicines, if they have not worked, then we say, all right, what can we do? Is there an option surgically to help? And so in that vein, we will talk about a couple of things. Number one, is this a problem where a disc is pinching a nerve? Is it arthritis that is building up, which can also cause a pinching of nerves? And so when that's the case, we typically grade the arthritis. And what we mean by that is we say, how severe is that arthritis? If it is severe, then typically the best option is where we go in and we remove the disc and entirely and we'll fuse the spine. And that's something that can be quite successful. But obviously we would love to be able to avoid a fusion if possible. So if we look at that arthritis and we say that it's a mild type of arthritis or really minimal, that's a best case scenario. And usually folks who are anywhere 30s, 40s, and sometimes even in their 50s, those are patients that we can consider a disc replacement for, which preserves motion. So the disc replacement is a device that helps to keep the motion present, and that helps down the line to preserve as much as we can of your natural motion. So those are some options that we follow when we're dealing with issues that just don't respond to those conservative measures that we'd like to begin with. If you guys are noticing these kinds of issues and you feel that you'd like to be evaluated, we're happy to take a look. Please call us or you visit the link below and we'll be happy to help.